Hello and welcome to this special episode of Startup Street. I'm Shruti Mishra. Today we are going to be talking with some special startup founders who are reshaping the future of Indian healthcare. Now, these startups were the batch of 2025 of CNBC-TV18's HealthX Elevate initiative in partnership with Optum India, an initiative designed to spotlight promising healthcare startups and place them at the very heart of India's innovation story. It's a movement to catalyze, innovate, collaborate, and scale impact across India's healthcare ecosystem. Joining me now are Aditi Roshan Pais, co-founders and COO Briota Technologies, Dr. Sandeep Vohra, founder, chairman, and managing director, No Worry, No Tension Healthcare, Siddhesh Kumar, co-founder and chief product officer, Lanek Technologies, Chirag Goyal, the co-founder of Vigrous Health Tech, and Sahil Jagnani, the founder and CEO of Primary Health Tech. Panelists, many thanks for joining us here. Again, my first question is a broad-based question. It's for all of you. Each of you is tackling a different piece of the healthcare puzzle, be it early detection, mental wellness, or connected care. So what's the big opportunity that you've spotted? What is it that you're solving that others have overlooked? Aditi, let me start with you.
We are talking about NCDs. Briota is on a mission to screen 30 million people by 2030. And NCD, non-communicable diseases, is one of the biggest burden which we have on, Indian healthcare. What we are doing is we are getting a cutting-edge technology at the doorstep where we are trying to find out, doing early screening and finding out the penetration of the NCDs in the Indian, pan-India, where we can identify the problem at the right time and the treatment can be started at the right time.
If you see, the mental health issues are, everywhere, wherever you read, see, and every house would have at least one person. What we are trying to solve is use technology to not only help at the curative level, but also at preventive level. So the present mental health care is curative based. Once you fall sick, only then the services are given. But what we are trying to do is working at proactive level, and that is how we have devised a concept known as emotional wellness index, which means you can screen the masses and analyze population at risk. And in some cases, you can prevent them from falling sick. And in some cases, you can actually understand whether the requirement is of a psychologist or psychiatrist. So automatic triaging. So this is what we are trying to solve. And India is such a huge country. We require multiple such initiatives to actually help at the grassroots level.
Absolutely. And we'll delve deeper into this. But Siddhesh, what's the pain point that you're solving?
So with ICMRs and IIT Kanpur support, we are developing point-of-care medical imaging devices so that we can make them accessible and affordable to everyone. So in PHC CSCs, we are enabling triaging at a very first stage so that the patient can be directed to the respective location. Like if the patient is from the heart, or from the cancer, from the TB, that is what we are solving.
All right. Chirag?
We started this entity with seeing few things like from many years. If you see in all the sectors, like if you go to airport, means everything have been digitized. If you go to restaurant also, order and everything have been digitized. But if you see the data that for the casualties, then it shows majorly that the reason of casualties belongs to some medical error and clinical errors. And the reason behind is the prescription. The root cause is like handwritten prescriptions and that kind of thing. That is still in the same handwriting, which nobody can read except maybe his pharmacist.
All right. Sahil, what's the opportunity that you've spotted?
So the problem that we are solving, let's suppose you are going to a doctor's clinic. The problem is that you have to travel 15 to 20 kilometers to get a consultation with a doctor. And that what the doctor is going to prescribe is the normal routine blood chemistry or blood test that is going to give. Let's suppose you are a diabetes, he is going to prescribe HbA1c. Now, the problem is that the result of that report or the result of that patient is going to come after a day or two. In cities, people are trying to solve that the result will come in 6 hours or 12 hours, but still the patient has to again come the next day to consult with the doctor. Now, what we are solving at MobiLab is a very clear problem that can we give the diagnostics at the doctor's site itself within 30 minutes. So the patient walks into the doctor's chamber, he waits for 15-20 minutes, the report is coming, and then the prescription can be done within that time itself. So he doesn't have to come back again. And you actually imagine a situation if it is a Saturday or a Sunday, the doctor, you can get a doctor, but the blood report will come after 2 days. Now, 2 days patient have to suffer just because routine examination of the blood, liver, kidney, heart, anemia, or the full body, if you say CBC, thyroid, are not available. What we are trying to develop at India, for the first time, indigenized medical device which can give you the full body test of a lab-grade quality, which is validated by AIMS and ICMR.
So basically, you claim to have built the first portable lab-on-wheel, diagnostic device. You're basically taking it beyond cities to tier 1, tier 3, smaller towns. But can you tell us what makes your solution truly interoperable? Because, it's not just another standalone device.
Yeah, so this device is not the hardware device. It is all connected to mobile application. There are dashboards. We have also 3 AI products that we have also integrated. So what we have observed, we have 150 plus clinics right now in India where there are mobile app powered clinics which are available.
All right. Coming back to you, Aditi, you focused on respiratory and chronic disease management using AI. So tell us, how is Briota turning patient insights or data into actionable insights, and how are you ensuring privacy, accuracy in that process?
The testings are happening, or the test is happening at a various location. It can be in the smart clinic, it can be at a PHC. So there are walk-in patients, there are some project-oriented patient, which we are talking about. The data is one of the biggest thing we are dealing with as we have AI, ML algorithms, getting worked on that. Data has been secured and we make sure that it is not for sale. Okay, whatever data we are acquiring through our test, it is only used to make our solution more stronger, giving them the right, accurate AI advanced solutions from the technology. And about the patient's name or patient's data, which need to be kept anonymous, we do generally blocking of the data when we do the further analysis of the data.
Okay, all right. Let me go across to Dr. Sandeep now. Mental health is finally getting the attention it deserves. NWNT claims it is India's first deep tech startup in the field of mental health. So tell us, how are you democratizing healthcare, emotional healthcare for 1.4 billion Indians? If you could take us through your offerings.
Yeah, okay. So, we can, if we want, we can ourselves check our blood pressure at home. If we want, we can check our diabetes, that sugar levels at home. Why can't we do the same for mental health? So what I did a lot of research and then scientifically validated a questionnaire. It's a 55-item questions. Anybody can actually fill it up and understand. Then I have coined a term known as emotional wellness index. So for a layman to understand whether they have a problem or not, and if they have a problem, whom should they go to?
Yes.
A psychologist or psychiatrist. This is totally uncharted territory from a clinical point of view. So my solution is for the masses. My solution is for the common man. You can understand at the time of COVID, RT-PCR was the gold standard. But at the same time, the issues were the cost as well as lack of human resources. And we came up with rapid antigen test. So what I am positioning my concept as equivalent to rapid antigen test, which means it's a self-analytical tool, but it is not a substitute of help or guidance from a mental health professional. So you analyze yourself, see if you have a problem, then you can take a call yourself. The biggest stigma as well as anonymity factor is covered here because you can do it. You don't have to go to anybody. People are scared to ask whom to go to for help.
Yes.
So people are scared. So that is the reason they either delay the treatment or they don't reach to the doctor, or even if they know that somebody can help them, they are so reluctant to go. So all these things are covered in this concept of stressometer and emotional wellness index. Plus, once you are sure that you have a problem, then our system connects you to both private as well as a government sector, which means people who can't afford can actually utilize the services of government telemanas.
But very quickly, if you can also tell us that how have attitudes changed, in therapy since COVID? Have people started believing more in digital interventions? What kind of attitude change have you seen?
Yes, I would say that attitudes have definitely changed after COVID, and telemental health has taken a center stage. People are more open to take solutions, and I would say Gen Z, especially the younger generation, is very open, and openly the mental health issues are being discussed. And thanks to few of the well-known people and celebrities who have come out in open and mentioned that they had a problem, and they have given the message that solution is possible.
All right, on that note, it's time for us to head into a short break, but don't go anywhere. On the other side, we continue this engaging conversation with the founders that are reshaping India's healthcare future. Welcome back to this special edition of Startup Street, where we are in conversation with the founders of innovative startups. These startups are a part of HealthX Elevate batch of 2025, part of CNBC-TV18's initiative in partnership with Optum India. This question again is for both Sahil and Siddhesh. Both of you are into deep tech, medical device startups. How hard is it to build, test, and certify indigenous tech hardware in India, and our regulatory frameworks, keeping pace to sort of say with innovation? Sahil.
Yeah, so that's the most important thing for a deep tech startup, particularly in the MedTech field. But thanks to the government initiative, I must say that our timing was good, that in 2018, the medical device policy was launched. And we were one of the first beneficiary that we were able to certify our device under the CDSCO framework. And also now ICMR has supported a lot. They have done the validation at AIIMS New Delhi. It has been a journey. Like in MedTech, you will be having, if you are building from scratch, then 5 to 6 years will go. Initially 3 years for prototype, then to regulatory validation. Yes. But if you see in India, there is a huge opportunity, because earlier, when you talk about the devices which were made in 2001 to 2015, there was two things which were missing. One is the digitalization, and the second was the mobile phone. Yeah. So when we are actually building, the time was right. When we started, we directly jumped into and benefited from mobile phone and the digital revolution that was happening. And that made one biggest opportunity or one biggest benefit that we were able to get it. We made the hardware very small. We made the hardware affordable, which is possible for a country like India or other developing countries, because earlier it was not possible, but thanks to all the initiative for the current government, it was very, very possible.
Siddhesh, similar views?
So first point would be that it is very tough to get the resources to develop these medical devices in India.
Absolutely, yeah.
So ICMR, IIT Kanpur, they have very big labs. So it becomes very easy to use their lab equipments and get the R&D done there. Second would be to get there is a barrier in the engineering and the healthcare segment. So it is very tough to get the clinical feedback directly from the users. So that was the major challenge that we have faced in this segment to develop these devices.
All right. I want to know now from Chirag and Aditi, when you pitch to hospitals or insurers, what convinces them the most? Is it the tech outcomes? Is it the data or the cost economics of it? Chirag.
So if I say about the hospitals, so hospitals are always concerned on the economics, right? That if they are paying X, then are they getting 2X or 3X or not? So they just see the ROI, what they are getting. And yes, data is always their concern, because they always think that if their data is going out, then they are not majorly concerned on the patient data, but they are majorly concerned on the financial data. That are we going to look into their financials, that how many OPDs, how many IPDs are going to happen. So it is very hard to convince them that no, we don't need that data. We are working on the medical data only. Yes. So it's very hard to convince them.
Aditi.
So he mentioned about hospitals. Let me talk about the insurance. Indian insurance sector is very huge and is very competitive. So when we are providing solution to the insurance companies, they look forward for putting themselves one step ahead of their competitor. Okay, of course, data is one of the major things which they look forward for, and that is their base of even commercializing that data into whichever way they go ahead with. But insurance sector look forward for such kind of solutions, tech-based solutions, patients, which makes them one step further, go one step deeper, and makes their solution more viable for the people of India.
All right. Let me go across to Dr. Sandeep. With even with apps, AI tools, awareness, and continuity of care that is available today, how do you drive sustained engagement with users, especially not metros?
Yeah, it's a very important question. So basically, we have to see that besides, giving our solution, we see to it that whatever problems are coming. So our solutions are B2C, B2B, B2H, and B2I. So depending on the degree of challenges they are facing and whatever have been the issues with them, we actually tailor make the solution as per the requirement. And regularly, we keep on updating. There are regular interactions in the form of seminars, or sensitization programs. We are instrumental in sensitizing, for example, for students. We not only we are sensitizing the student, but we are sensitizing the decision makers of the college authorities, school authorities, or the owners of the school. So it's a task in which you have to actually change the mindset of lots of people, because the end user will get it only if the people sitting above are convinced with your product.
Sure.
So you have to constantly, convince them, interact with them. And many times where I get success is that, though it's an indirect form, suppose I'm interacting with these people and somebody has a person in the family who has a mental health issue. And if they bring that person to me, then I don't have to do anything. My project automatically takes off. Unfortunately, it has happened in many cases. The owners themselves have had a problem. And when they saw that when the patient was brought to me, their near and dear ones, they could actually see the real life practical example of how counseling and medication can change the life of millions.
Yes.
And that is the reason why we are coming up for with the country, for this whole country. We want this sort of solution should reach the remotest part of the country.
All right. My next question is open to all of you, whoever would like to answer. Healthcare entrepreneurship is many a times deeply personal. Is there a story or a moment that you'd like to share that made you take a plunge into this space? Any one of you?
20 years back, I was appearing and I was answering questions. There used to be a daily show in the morning. So once I came back to my clinic, after the show, few days later, I saw a man from very remote village of the country. He came with his daughter, who was 17 years old. That old man came and touched my feet. I was surprised. And he said, "Sir, do you look at this daughter of mine?" I said, "Yes." You have been able to prevent her committing suicide." I was flabbergasted. I said, "I have not seen this patient. What has happened?" So he said, "Sir, during your morning show, you were mentioning that if you get repetitive thoughts of religious thoughts which are obnoxious, it is not that you are thinking against God, but it is an illness known as obsessions. My daughter was going to jump in the village, and because of this program, he understood this is a mental health problem. I think somewhere down the line, that gave me a jolt, that my appearing on a TV channel can prevent somebody's life like this.
My final question to all of you, again, it's open. We'll start with Aditi from there. If you had to describe your mission in one life or that one target that you'd like to achieve by 2030, what would that be?
Yes, we are on mission. We always talk about it. We want to screen 100 million people by 2030 for NCDs and make sure that all of us, we are only talking about affordability and accessibility of a good healthcare pan-India, and that is what we look forward for.
All right.
The United Nations on 25th August, 26th August, yes. September. 25th September has given a political statement that all over the world, along with communicable diseases, mental health to be integrated, and they expect by 2030, 80% of the countries should be able to analyze, monitor, and do the complete surveillance of mental health disorders in their respective countries.
Okay.
So I am so happy to share with you that I have been granted patent of this emotional wellness screening just 6 days back. And with this, we can actually do it, and India can be the leader in mental health by 2030, because this is the only way where you can actually not only screen, but monitor and do the surveillance pan-India.
Well, congratulations on the patent as well. Siddhesh.
Yes, so our mission is to equip India with made in India imaging devices. And secondly is to take these devices to all the CHCs and PHCs and screen every people for different pathologies, diseases.
All right, I like the Made in India devices. Chirag.
And when we started from the day when we have the main one vision that how we can reduce and make it towards 0% on the medical and clinical errors, which happens just because of majorly that either they don't have the knowledge or that kind of thing. So our main vision is towards reducing and medical errors.
All right, Sahil, your big target.
So as a MedTech innovator, one thing that I've seen that when we are actually developing the device and doing the validation of the device, we have been compared with a device which is 100x in cost compared to our device. And when we got the accuracy, what we have observed that there will be an India-made solution which is going to change the healthcare at primary care. And with this vision, what we are working on towards is that how we can impact 1 billion lives and save lakhs and lakhs of people through early diagnosis.
Thank you so much for sharing your milestones with us. With that, it's a wrap on this engaging conversation. As we wrap up this special edition of Startup Street, one thing is clear: the future of Indian healthcare is being written today by innovators who are daring to think differently and building for impact. From the entire team, goodbye and many thanks for watching.